We have been providing services all along, virtually through the phone and through computer access in the web, but have had our buildings closed to public service. At one point, we had even taken individual appointments, but most recently, of course, we have been shut down to public access completely and just gone to our online and virtual services. I think you all are pretty aware, but the governor previously had an order in place that was called Stay at Home, and that was to be in place until June 10th. He hasn't officially lifted that yet, but we understand that he will be. He's now transitioned to something called Safer at Home rather than Stay at Home. We had targeted the opening of our facilities to the lifting of the Stay at Home. So now that he has created really a different status, as of yesterday at his briefing, it has put us in a mode of preparing to open consistent with his other order, which basically means that all non-essential businesses can open as long as the data continues to be positive in terms of moving in the right direction Friday. And I think you all are pretty aware of that, but that background has set us into a different mode of planning for the 15th to reopen rather than the 10th of June. So we have been working on that. Our leadership team has been working on guidelines that we can use for our staff. So at this point, we do plan to reopen a week from this Friday, which would be May 15th, unless the governor makes a change. And we will bring our employees back on May 11th, which will be Monday of next week. We have communicated out to our employees that we are going to be doing that, and we will bring them in the 11th so that we can prepare our facilities and prepare them to be able to provide services in this new environment, which will still need to focus on safety of our employees and the public in some new different kinds of ways. We will, as we go forward, follow all the CDC, federal and state guidelines. Some state guidelines have actually not been issued yet for businesses to open. We expect that in the next several days, and we'll incorporate those into our own plan as we go forward. We have already incorporated those into a COVID-19 recovery plan for opening, and our leadership team has reviewed that extensively. And we are moving forward as of today with a plan that will guide us through this period of time. That plan will include some of the following things that are important as we reopen to the staff and the public. 10% limit on customers and departments, following strict social distancing guidelines. We will be doing temperature checks of all employees and customers at the front door as they come in, and our common areas will remain closed. Our employees will be required to wear masks if they can't maintain social distancing and when they're in public spaces and may come across others. We will have plexiglass installed in all customer counters so that our staff and the public will be protected. We will be continue to do extensive cleaning and disinfecting of all of our areas. And our staff will work on shifts and continue teleworking to reduce the total number of staff in the building to therefore reduce the risk of transmission, just as our staff are in the building. Each department is going to develop their own plan for how their department will operate, how they will manage the 10-person limit. As an example, we will have markers on the floor to make sure that people stand if they are in any kind of line. Let's just say less than 10 folks in a line, that they will be at least 6 feet separated from each other. So these will be the conditions we'll be operating under during the phase one of this. The governor said yesterday that if the data continues moving in a positive direction in terms of reduction in hospitalizations and cases, that we could move as quickly as 2 weeks into phase two. The primary difference in phase two is that we would then allow gatherings of 50 people instead of just 10. All of the other measures, however, would stay in place until we get to the point where we reach phase three. He has basically said that he expects between 2 and 4 weeks between phases. So if the 15th is the beginning of this, that could mean by the 1st of June, first part of June, that we would move into phase 2 and then progress on to phase 3 whenever that would occur. But that's generally where we are, Madam Chair, in terms of our preparations, employees coming back again next Monday, and our plans to reopen to service on the 15th, continuing to continuing to utilize teleworking and shift work, ensuring a high level of service, but also reducing the total number of folks in the building so we can reduce that risk of transmission. So that's the highlights of where we are.